Well, good morning to everyone. It's my pleasure to be back at the State Fair. Not a normal State Fair situation that we have today. First, this State Fair is such a phenomenal success story. You know, you have to remember what it was a few years ago and what it is today, and it is night and day. We've been breaking all sorts of records, attendance records. It's revitalized the entire region. I want to congratulate everyone who's been associated with the fair, but I want to give a special thank you and shout out to Troy Waffner, who's done a great job. Let's give Troy a round of applause. And now, this site, State Fairgrounds, great recreation area, great attraction, it has transformed itself to where this site is today the second largest mass vaccination site in the United States of America. It did 9,500 vaccinations in the past 24 hours, second only to Javits Center. Isn't that amazing? Give the whole group and the National Guard a round of applause for what you're doing here. I want to welcome some special guests who are with us today. You're going to hear from Anne Marie Talercio in a moment, right after me. Then you're going to hear from who represents the AFL-CIO, as you know. Then you're going to hear from Fanny Villarreal, who represents the YWCA. And then you're going to hear from Pastor Draper, who is going to speak on behalf of all the pastors who are here and the faith-based community that is working in partnership with this organization. I also want to recognize a special member of our society for many, many years, a great, great leader, Van Robinson. Let's give him a round of applause. We also have Paul Dickens with us from the CSEA, and I thank him. Look, where we are now in this long journey of this past year, we are now coming down to the end. Are we at the end? No. That's why we have to stay smart, we have to stay safe, masks, etc. But we're at the beginning of the end. And the end is the vaccine. The vaccine is the weapon that wins the war. We know that. It's been tested. It's been proven. Now, you have to make the weapon, and that's taking time. Biden administration, God bless them, has increased the number of vaccine distribution. They've moved it up, so we're going to have many more vaccines faster, and that's good news. But you have to make the vaccine, you have to distribute the vaccine, which is a massive governmental operation. Nobody's ever had to mobilize like this in this short a period of time. It's what today's center is all about. And then third, you have to get people to accept it. You can have the vaccine, you can have the distribution center, but until that needle is in an arm, it doesn't mean anything. Now, the supply of the vaccine is dependent on the federal government. And that ebbs and flows. Why? Because when the Biden administration came in, they didn't have enough vaccine for the country. They just had not bought enough vaccine. President Biden comes in, opens the vaccine cupboard, the cupboard is bare. They have scrambled and they have secured more vaccine, but it's uneven. So we got a big dosage of Johnson & Johnson. One shot, great. We got that last week. But then it's going to trail off for a couple of weeks, and then it's going to increase again, the supply. So you're going to see an unevenness to the vaccine. Everybody says, I want the vaccine, why can't I get it? Because there's not enough vaccine. That's the simple answer. And you are going to see this ebb and flow in the supply from the federal government. That's a fact. We're going to have to deal with it. It's going to be still an annoying few months, but we're getting there. But the supply is increasing. If the supply is increasing, we can then increase our distribution levels. And I'm very pleased to say today that our first level was 65 years old plus, right? Because COVID affects older people more. So our initial threshold was essential workers, nursing homes, 65 plus. We're going to drop the 65-year-old plus to 60-year-old plus, and that's going to start tomorrow. So now 60-year-old plus are going to be available. They can start making appointments tomorrow. They can make them at the mass vaccination sites. They can make them at pharmacies. But that will start 8 a.m. tomorrow. 60 plus, that means people like as old as I am now will be available, eligible for the vaccine. Second, all sites starting March 17th, next Wednesday, all sites, county sites, FQHC sites, mass vaccination sites, we have thousands of distribution sites. All sites, to simplify the situation, can vaccinate anyone who is eligible, all right? So whether you're going to a county-run site, a city-run site, what they call an FQHC, every site can vaccinate anyone who is eligible, with one exception. Pharmacies still will only be doing 60 plus and teachers. 60 plus and teachers. Why? Because the pharmacies, it's not as easy for them to identify different types of workers, etc. They can identify age, because age you can identify by just the driver's license. And President Biden, rightfully so, has made teachers a priority. So pharmacies will do 60 plus, and teachers, we want to get those schools open. Every other site will be doing every other person who is eligible. Also on March 17th, next Wednesday, the public-facing public employees will also be eligible. Not-for-profit public-facing emergency employees and employees who are providing necessary services like the YWCA, they will also be available. Essential public workers will also be available. Public-facing building workers will also be available. These are the people who are the everyday heroes, who are out there doing their job. They're putting themselves in a possible position of exposure. They are essential for us to continue operating. They're going to become eligible on March 17th. Let's give them a round of applause. Last point is the distribution is working. It's going out. It's going out fast, not as fast as we would like, but as fast as the supply allows. It also has to be fair. It has to be fair. And we've talked about this from day one. COVID discriminates. COVID discriminates by race. They say the virus is race blind. Yes and no. It will infect anyone. But by circumstance, it infected blacks and Hispanics more than whites. Twice as many black people died from COVID as white people. Twice as many black people died from COVID as white people. Just think about that. 1.5 times as many Hispanic people died from COVID as white people. Just think about that. COVID discriminates. Black population had less access to health care. Hispanic population had less access to health care. Black Hispanic population had more comorbidities, more underlying conditions. That's why COVID preyed on blacks and Hispanics more than they did the white population. So when it comes to the vaccine, it is very important that we correct that injustice and we make sure that we have access to everyone. You take Central New York. 87% of the population is white. 94% of the people who receive the vaccine are white. 87% of the population, 94% of the vaccine. Black population, 11%. Only 5% of the vaccine. Hispanic population, 4%. Only 2% of those who have been vaccinated. Asian population, 3%. Only 2% of those who have been vaccinated. So, we need to increase the vaccination number for the Black, Hispanic, and Asian population. One of the reasons the pastors are here today is to say, look, we understand there's a hesitancy issue. I don't like the word hesitancy because it's a muddled word. There's a trust issue. Black community has less trust of the system. Oh, how can you say that? It's true. It's true. Tuskegee experiment, they have less trust of the system. Well, the Trump administration said it's safe. I don't believe the Trump administration, says the black community. By the way, I don't believe the Trump administration, says me, Andrew Cuomo. We had a New York State panel that also reviewed it. We've done 6 million dosages. It's worked. Top black professionals, medical professionals in the United States say take it. I've recommended it to my mother who has taken it. I'm going to recommend it to my daughters who have taken it. I am going to make an appointment. I am going to take it. The pastors who are here today are saying take it. There is no reason why anyone would be recommending this vaccine unless they believed it saved lives and has proof that it saves lives. We want to stop this virus. We have to stop the virus. You know how you win a war? You go out and you win the war. You go out and you defeat the enemy. The enemy doesn't defeat themselves. No war does the enemy defeat themselves. All the training that the National Guard receives, the Army receives. Nobody ever says, wait for the enemy to destroy themselves. Go out there and crush them. You know how you crush them? You crush them with this vaccine. But we have to take it. And then let's get back to work. Let's rebuild this economy. Let's rebuild this state. Let's get our lives back to normal. Let's get children back in school. Let's get paychecks back in homes. Let's get normal society functioning again. This vaccine is the ticket. We just have to make it happen. Thank you, and God bless you.